Right. Hello friends, myself Dr. Himanshurastogi. Today we have discussed about the topic the inflammatory bowel disease. And the inflammatory bowel disease are the two types. First is ulcerative colitis and second is Crohn's disease. These are suffer from the severe infection of intestine, of the large intestine, and sometimes it may involve the whole GIT in the Crohn's disease. And symptom is come in the ulcerative colitis and Crohn's disease is blood mixed stool pass during the defecation, whose motion is increases up to the 15 to 30 times in a day, and sudden abdominal spasm and increase the urgency at any time to going washroom or toilet. In the IBD, ulceration of the intestine. First we have discussed about the ulcerative colitis. In the ulcerative colitis, ulceration in the rectum area, that is called a proctitis. In the rectum area having cause inflammation. The ulceration form under the the inner two membrane involved during the infection of the ulcerative colitis, that is mucosa and submucosa. During the defecation, the blood mixed stool is passed. Itching on the rectum area, pain, severe abdomen pain on the basis of mild, moderate and severity. If the mild and moderate state, it be easily treated, and thus in the case of the severe state is difficult and hardly managed. If the ulceration is involved in the rectum and sigmoid area, that is called a proctosigmoitis. In the infection, the ulcerative colitis is a constant, not extend discontinuous patches like a Crohn's disease. It is a constant and inflammation in the ulceration on the intestinal wall. It is caused by autoimmune disorder, which is a fast defense mechanism developed against the intestine and having caused ulceration, bleeding, and it is very difficult to cure. Ulcerative colitis is only involved the large intestine. When the whole colon is involved, the size of the intestine, the side of the large intestine may be big and enlarged. These are the symptoms in the ulcerative colitis. Whenever we have go to the Crohn's disease, the Crohn's disease involve the whole GIT system, and it is a discontinuous patch. In the ulcerative colitis, it is a continuous patch. The most prominent part in the Crohn's disease is ileocecal junction, having discontinuous patches and inflammation. It involves the transmural layer. Having a 4 layer of the intestine, which have involved and cause ulceration of the 4 layer of the intestine, that is mucosa, submucosa, muscularis, serosa. The whole layer is involved in the Crohn's disease, but in the ulcerative colitis, the 2 layer is involved. That in the ulcerative colitis, mucosa, submucosa is involved, but the Crohn's disease is having 4 layer involved. Whole layer is involved in the intestine. That is mucosa, submucosa, muscularis, and serosa. Whole layer is involved. It may cause perforation of the intestine, having formed passage of a fistula, having a chances to growing the colon cancer, and also forming the granuloma. How to identify difference between the ulcerative colitis and Crohn's disease? In the ulcerative colitis, it is involved only on the large intestine, but in the Crohn's disease, it having a whole GIT involved. It is a discontinuous patch involved in the small intestine. It is a discontinuous small patches in the intestine, which is a discontinuous and with inflammation and having ulceration of the intestinal layer. Perianal area is involved in the Crohn's disease. These are the difference between the ulcerative colitis and Crohn's disease. This is the CT abdomen test, whole GIT, and same features like come this, and endoscopy is doing, and other rectoscopy, colonoscopy, whole colonoscopy is involved for the further investigation, and biopsy is also taken from the sample of the intestine to detect the ulcerative colitis and Crohn's disease. These are the difference between the ulcerative colitis and Crohn's disease. Watching the video and gain about the knowledge of the ulcerative colitis and Crohn's disease, that is IBD, and start subscribe the channel. Thank you.